Ankle arthritis is a disorder of the cartilage of the ankle joint, and this can occur due to a variety of reasons. It could be rheumatologic or inflammatory in nature, but most commonly it's due to trauma, and that can be after an ankle sprain or a fracture, ankle fracture, or any other kind of trauma to the ankle joint itself. Ankle arthritis really is loss of cartilage in that joint, in the ankle joint, and we treat that in a variety of ways. So most commonly we treat it with non-operative treatment, such as injections. So we can inject a steroid into the ankle joint. We treat patients with anti-inflammatories or oral steroids, physical therapy occasionally, and bracing. Occasionally, when those don't work, we need to consider surgery. And surgery of the ankle would involve ankle fusion versus ankle replacement. And the two bones that we treat are the tibia and the articular surface of the talus. When we treat it for an ankle fusion, we take away the cartilage surface of the tibia as well as the talus, and we fuse those two bones together. And when they fuse together, that eliminates pain, and patients are able to really do any activity after that. I let patients do whatever they want as long as the bones have healed. The other treatment, as I mentioned, is ankle replacement. Again, we take away the articular surface of the tibia as well as the articular surface of the talus, and we replace those portions with metal and plastic. Now, this allows patients to actually move their ankle more after surgery and allows them to basically maintain their range of motion while also eliminating pain. There are some restrictions. Patients are generally able to do everything that they enjoy doing, but there are some restrictions to the level of intensity after that. We now have very good data on ankle replacement, and it's a very good surgery, similar to total knee replacement and total hip replacement. Patients get fantastic relief of their pain. To know whether you may benefit from one of these surgeries or some of the non-operative treatment options that I mentioned, please call us at Kona and I'd be happy to see you.